Assalamu alaikum and hi. In today's video, we are going to discuss about potency and efficacy in pharmacology. So let's start the video. Definitions. Potency. Potency refers to the amount of a drug required to produce a specific effect, usually at a given concentration or dose. It indicates the strength or concentration of a drug needed to achieve a particular level of response. Efficacy. Efficacy, also known as maximal efficacy or intrinsic activity, refers to the maximum effect that a drug can produce, regardless of the dose. It describes the magnitude of a response elicited by drug at its maximal effect. In potency, we just see the concentration of a drug to needed to achieve a desired level of response. While in the potency, we see the maximum effect of a drug. Measurement. Potency is typically measured by determining the concentration or dose of a drug required to produce a specific level of response, such as 50% of the maximum effect, effective concentration 50% at 50% population, and effective dose at 50% population. So these are the two approaches by which we measure this parameter. Efficacy is measured by assessing the maximal response. Again, efficacy is the maximal response of a drug elicited by a drug under optimal condition, often expressed as Emax or maximum effect achieved. Relationship to dose response curve. Potency affect the position of dose response curves along the concentration or dose axis. A more potent drug will have dose response curve shifted toward left. Very important, indicating that it produces a significant effect at to lower concentration or doses. Very important, the amount of a drug which is less in concentration will be more potent as compared to the same drug having higher concentration. Efficacy affect the shape and height. Here, both shape and height of dose response curve is affected, while in the potency, only the position of dose response curve is affected. So, very important to remember. A drug with higher efficacy produces greater maximal response, resulting in a higher Emax on the dose response curves. Here, toward shift toward left will be noted in the case of potency, while in the case of efficacy, height will be noticed. Here you can say again drug A is more potent because their position is toward left. Drug B is less potent, but the maximum height of drug B is greater than drug A. So the drug A has got higher efficacy, while drug B has a higher efficacy, drug A is lower efficacy, but drug A will have higher potency and vice versa. Here you can say that drug A and drug B. Drug A is more have more efficacy, while drug B is less effective or less having less efficacy. But the potency of both are same. Here, the efficacy of both drug is same, but the potency is different. Drug B has got more potency, while drug A has less potency due to shift toward right. Here, maximum height is different. Here, the position and distance from left side is different. Clinical implication. Potency influences dosing regimes and drug selection. A more potent drug may require lower dose to achieve the desired effect. Again, lesser the concentration, more will be the potent drug, potentially reducing the risk of side effect or toxicity. Again, potency is beneficial while calculating side effect and toxicity. However, potency does not indicate the therapeutic usefulness of a drug. The single parameter which show us the therapeutic effect of a given drug will be efficacy, not potency. Efficacy determines the therapeutic effect of a drug. Very important. Drugs with higher efficacy are more likely to produce greater therapeutic responses, making them more effective in treating the targeted condition. Maximal efficacy is an essential consideration when selecting drug for specific clinical situation. So, a very important concept to consider. Examples. Oxycodone is more potent than codeine, such as analgesic. Both are analgesic, but codeine will require less. Oxycodone will require less concentration, while codeine will require more concentration to achieve a desired effect. Meaning that a lower dose of oxycodone is required to achieve the same level of pain relief compared to codeine. Very simple. Efficacy. Morphine has higher efficacy than tramadol as an analgesic. Morphine can produce a more profound and maximal pain. Again, maximal pain. No regarding concentration compared to tramadol even at equivalent doses. Summaries. In summaries, potency and efficacy are distinct pharmacological properties of a drug that influence its therapeutic effect. Potency refers to the amount of a drug required to produce a specific effect, where efficacy describes the maximal effect that a drug can produce. Understanding both potency and efficacy is essential for optimizing drug therapy and selecting the most important and appropriate treatment for a given clinical scenario. So that's all. Thank you so much for your attention. If you learned something valuable from this video, please give me a favor, like this video, subscribe this channel, and thank you so much for watching.